And this plays into the gallbladder. Like Claire said earlier, it's so common. Estrogen dominance and gallbladder issues go hand in hand, and you will see a number of clients who have their gallbladder removed, and it can be coming from an estrogen dominant picture.
What's the medical? There's the four F's, isn't it,
Yeah,
for
female,
gallbladder? Female,
fat,
fat,
which I don't think
which is a
is
horrible,
horrible,
40
fertile.
and fertile. Yeah.
Yeah.
So estrogen, obviously estrogen with the insulin, with the obesity, and yeah, huge estrogen dominance issue. So this is what I mean by when we're looking at someone's health history, we're either seeing things like a series of miscarriages, or they were having cyclical migraines when they were 16, bad periods, they were put on the pill for acne, like all of these things. And also maybe then we're looking at they had their gallbladder removed, or they've had gall issues. Okay, we're definitely looking at, some estrogen dominance there, and maybe progesterone deficiency before.
So what's happening in the body is that estrogen dominance increases the absorption of cholesterol in the bile, which makes the bile thick and sluggish. And our bile is part of the digestive system to break down our fats. So what this results in is problems in digesting our fats and cholesterol crystal formation, which is the gallstones building up in the gallbladder. When we're not digesting our fats properly, this impairs the gut microbiome's job in processing hormones. So there's this dual effect that's happening with estrogen dominance. One of the things that it also adds extra stress to the poor old liver, and we're going to come on to the importance of healthy liver when it comes to estrogen. That's coming up. So if you have someone where you're thinking estrogen dominance and there's some gallbladder issues going on, also consider SIBO. We have another talk on SIBO because when there is that gut bacteria overgrowth in the small intestine, it can stop it actually consumes the bile, which stops the fat digestion, which creates the wrong environment, which means that we reabsorb our estrogen. So there's just this constant cycle happening, which is just, I find fascinating.
It is. So as soon as I see gallbladders, I think progesterone deficiency slash estrogen dominance. I think gut issues because of the SIBO, and therefore I usually come back to wheat intolerance as well. The first thing I do is look at their diet, see wheat, think SIBO, and also look at their health history.